Hello and welcome to these videos. My name is Russell Samuels, and in the following videos I'm going to show you how you could make various adjustments to the Nitom2 locking orthodontic Facebow. So let's go forward and have a look at this piece of equipment. So this is the Nitom2 locking orthodontic Facebow, and it's used either with a head cap or a neck strap to provide additional anchorage in a selected group of orthodontic patients. Extraoral traction is still a very useful way of providing additional anchorage in a select number of orthodontic patients. Now, the Nitom2 locking orthodontic Facebow is a self-retentive Facebow, unlike the standard or clone type of bow, which has no self-retentive mechanism. It has a simple inner bow welded to or soldered to an outer bow, like this sample here. This prevents the Facebow coming out of the tubes accidentally, especially at night. The reasons for using a self-retentive Facebow are well documented in the orthodontic literature. Suffice to say, there are very good reasons for using a self-retentive Facebow rather than the old standard Facebow, but these videos will restrict to the practical aspect of making various adjustments to this type of Facebow. These Facebows come individually packed, and if we look at the literature within the packaging, you can see that you will have a choice of 5 inner bow sizes and 2 outer bow sizes. And as we can see, the indication here with the colouring is that this is a size 4 inner bow and a short outer bow. And when we have a look at the Facebow, you can see that there are 4 laser dots in the middle, and this short outer bow ends in the same region as the upper first molar. Now, say you've chucked your packaging away, you've kept the Facebow, you haven't used it, and you've picked it up later and you can't remember which size it is. All is not lost, because if you refer back to the middle of the Facebow, just on the outer bow margin, you can see, if I can just catch that on the light for you, there are 4 laser dots there indicating that this is a size 4 inner bow. And as you can see, it's also a short outer bow. The outer bow is recessed already and capped. The recessing is to help counter any snagging that might occur between bedding and clothes and the Facebow, and the capping is to make the ends smooth and blunt. The joints between the clip and the inner bow and the outer bow and the inner bow are all now laser welded to avoid the use of solder and any possible reactions it may create in your patient. This Facebow does not come out of the packet ready to fit your patient. Like most pieces of orthodontic equipment, it needs to be adjusted to fit your patient. To save on clinical time, there are 3 things you can do before the patient attends to have their Facebow and headgear fitted. Firstly, you can select the size of Facebow that's suitable for your patient by using the patient's upper study model. Secondly, you can adjust the width of the inner bow to fit the size of the upper arch of the patient, again using the study model. And thirdly, you can check that the clips are in an ideal position on the Facebow for the patient to be able to use them when they're fitted. Now, when choosing the size of the Facebow, remember that when the ends of the inner bow are approximated to the position that the EOT tubes would be in, you need plenty of clearance labial to the upper incisors so that you can fit brackets if required, and if the Facebow starts to move distally, you don't knock on the upper incisors and risk possible devitalizing them. So on this particular model requiring those dimensions, a size 4 looks about right. So with the clips closed, take hold of the Facebow in the middle and then just tease gently, a bit of teasing just to close down the distance between the inner bow, and then you can see it's still a bit wide, so we just tease it a bit more. And then you can see now it's about right, and you've got a good 3 to 4, maybe 5 millimeters of space anterior to the upper incisors to accommodate any brackets that you may have and any distal movement that may occur in the Facebow during its use. And the third thing that you can do is you can adjust the clips if required to make sure they're in an ideal position, which occasionally they're not when they come out of the packet. So this is the Facebow I've adjusted up to this point in time, and I'm going to put this to one side for a moment, and I'm going to bring in one that I've already adjusted so that you can see where the clips ideally should be when in use. So if we look at it first of all from the side, you can see that you've got a laser welding to the side of the inner bow. Then you've got a helix, flat platform, an omega loop, another flat platform, and then a J end clip. And if I just raise this, you can see it's a J at the end. Okay. So if we look at it from the top, ideally we want the clip to travel next to the inner bow, parallel to it, starting at the weld, through the helix and along the first flat platform, through the omega loop, next flat platform, and the J at the end. And the J needs to cross the inner bow at right angles to the inner bow and leave about 1.5 to 2 millimeters of the end of the inner bow protruding out past the J hook, and the same for the other side. So if we look at this, we can see it does all those things. Now, when the clip is unclipped, it should lie directly below the inner bow. You do not want the clip to be in this position, and you do not want the clip to be in this position when it's unlocked. You want it to be straight and just underneath the inner bow like that. When it's active, it'll have about 30 degrees of activation in it. And if you need to activate it a little bit more, you can get hold of your plier, and just in front of the helix, you can bend it downwards a little bit, making sure you don't swing it out or swing it in, and then you can close it. And the same, you could end the same on the other side. Okay, and then when you've done that, you're ready to go to fit your Facebow on your patient. So let's bring back the patient's Facebow and see how ideal it is when it comes out the packet? Well, as you can see on this side, the clip does travel parallel to the inner bow, but when it gets to the end, you can see there's too much inner bow sticking out, and the end of the J, or the J at the end rather, is angled. It's angled slightly inwards as it crosses over. It's angled slightly like that, whereas it should be at right angles to the inner bow. So we need to adjust that at the end, and if we look, it actually sits passively in a good position. So what we need to do is adjust the J so it's at right angles, see how much inner bow is still sticking out, and if we need to, elongate the clip a little bit using the Omega loop. So if we just raise the catch, we can raise the catch like that, and then I can just get hold of the J and give it a little twist like that. And then if we just look at it over there, we can see that's much better, more at right angles, but we've still got a little bit too much of the inner bow protruding. So we're going to go to the Omega loop on the clip and just put it in between the beak of our Adams plier. And I'm now going to just squeeze that curve in the top of the Omega loop a little bit flatter. There you go. And then at this bend here, if that foot has changed position and it's not in line with the back foot, I can turn it back up, but it's actually stayed in line with the back flat platform quite well. So if we look at it, we can see it's still a bit long, so we need to squeeze a bit more. And just there. And now we can see that's much better. Check that it's still sticking underneath, sitting underneath the inner bow. It is. How much activation have we got? Oh, not very much. So let's just activate it a little bit. Get hold of it here, making sure you don't change its relationship to the inner bow. Just down a bit. There you can see parallel. That J could possibly do with a little bit more adjusting. I'm just going to, can you see I've just done a little bit of a twist in that direction. And I think now it looks a bit more like it. There we go. And if we look at the other side, you can see that the end of the inner bow shows too much, and also you can see the J hook is angulated in a bit. So let's re-angulate the J hook and see how much end of inner bow is still sticking out. That's certainly crossing more at right angles, but we've still got too much sticking out. So squeeze that, get hold of the Omega loop. And you can see now that we've got about the right amount. So if we just check that it's in the right position, passively sits underneath, could possibly just go in a fraction. The curve starts there. And it needs a bit more activation. So if we just go mesial to that and curve it down, There we go. Make sure we haven't gone in or out. That's good. Now, if we were to be over enthusiastic and push this J hook clip too far down the Facebow, like say, like that, that's a bit too close to the end. Okay, it's easier to knock it off at the end when it's that far along. So if we want to now bring the J back towards the omega loop of the inner bow, we get hold of the omega loop on the clip and just turn it on itself. So can you see I'm just turning it like that, just turning it like that. There you go. All right, so that's about right. Okay, so now we have our two clips adjusted to about the correct position. We're now ready to go to the last stage, which is fitting the Facebow to the patient. Okay, so far we've chosen what we think is the correct size of Facebow for our patient. We've chosen, if we forget, a size 4, and we've adjusted the clips on both inner bow arms, and up to this point in time all this has been done quietly in our own time on the patient's upper study model before they've even attended the surgery. So now we have a Facebow that's ready to fit the patient. And before we do that, let's just have a look. If I unclip this and point out a couple of things to you. This flat bit here I'll refer to as the foot of the inner bow, and this hump I'll refer to as the omega loop in the inner bow. Okay, so we'll start with the two catches locked. That's where we ended up. Now we're going to open the two catches, check they're still got some activation in them, look at them from the side. We could do with a little bit more on this side. Okay, now we've got our patient who comes and sits in the chair, and for our patient today we're going to use an upper study model with 2 bands cemented to the upper first molars. Now if you're going to use headgear with a Facebow, you must use bands cemented to the upper first molars. Do not use any bonding tubes. Right, now, so when you fit the Nitom Facebow, imagine this is the patient in the upright position or standing up. The way to fit the Facebow is with the clips facing downwards. I always remind people, remember the Starship Enterprise, and it's the engines going downwards. And once we've fitted it, it's all downhill. Something like that to help you remember. So fit the foot of the inner bow in on one side, or the first side. So we'll call this side 1 and we'll call this side 2. So when you've put side 1 in, look with the Facebow completely passive, just look and see where the foot of the second side sits in relation to the EOT tube. And you can see without touching it that it's slightly too far distally. And what you really want is for it to be up over lying there passively, but I'm having to move that. So what you need to do is take the first side out and put a little bend in the foot on the first side, toe out or slightly pointing outwards. So let's do that. So if we take that out and if we get our plier, now we're going to get hold of the whole of the foot. Do not be tempted to hold the foot halfway along its length. If you do and start putting the bend in here, you'll find that when you come to put it back in the EOT tube, it won't fit. It jams and you can't get it out and you can't get it back in. So if you're going to bend the end of the inner bow, you need to get hold of the whole of the foot in your plier, like so, and then in the plane of the Facebow, not going up or down, in the plane of the Facebow, you're going to put a little bit of toe out. Okay, and it's just a little bit of a guess. Toe out. Then you go back to your model, put side 1 back in the tube, and then look and see where side 2 is. So side 2 has come up a little bit, and this time it's a little bit wide, so maybe we can contract it a bit. So close our clips. Get hold of the middle, and then just a tiny bit of a squeeze. Open the clips again, and then put the side 1 in only, and let's look at side 2. And you can see now it's nearly where we want it to be. So, but it needs to come back up just a tiddly bit now. So a little bit more of a toe out bend on this side. So we go to this side, get hold of the whole foot up to the omega loop, and a little in the plane of the Facebow, a little bit of toe, more of toe out, and then we put side 1 back in. And now we check side 2, and side 2 looks a lot better now. It looks like it's just passively sitting over the tube housing. Now, this is where a lot of people make a very common mistake, which is to now just stick the Facebow into the patient's mouth, push this side in and get on with it. What you need to do is to take side 1 out, put side 2 in, and then see where side 1 sits. As you can see, it doesn't sit passively over the tube. It needs to come up a little bit there. So we need to put a little bit of toe out on this side so that that sits passively on side 1. So we take this out. Again, getting hold of the whole of the foot of the Facebow, and then in the plane of the bow, little bit of toe out. Go back to our model, put side 2 in, and now we can see side 1 just needs to come up a tiddly bit more, so we want a bit more of a bend in side 2. So we go to side 2, get hold of the whole foot in the plane of the inner bow, a little bit more of a bend, and then we put side 2 back in the tube, and then we look at side 1, and we can see that side 1 is nicely aligned over the tube on side 1, EOT tube on side 1. So we take side 2 out, put side 1 in, double check that we haven't knocked side 2 out, It's still sitting over the tube nicely. So we can now put tube side 2 in, and then going to side 1, we can bring the Facebow slightly measly or forward, compress it inwards or towards the teeth, and then line it up with the tube housing and slide it in. And then we can pop the 2 clips on to make sure they fit, and they do. And we have now fitted the Facebow to our study model, which represents our patient, and you can see there's a little bit of play in the tubes to accommodate different designs that you might encounter. Now, having done that, you need to fit your head cap or your neck strap, whatever you're treating the patient to. Adjust the angle of your outer bow, either up, keep it level, or slightly down, depending on your first molar position and what force you want, and where the center of resistance is. And then don't forget to contour your outer bow to accommodate the patient's face. That would then mean your outer bow would be about 1.5 to 2 centimeters clearance from the cheeks of the patient. Once you've fitted the Facebow to the patient and set up the headgear, you then need to show the patient how to fit the Facebow and the headgear to themselves. To do that, I personally like to have 2 models already set up, and the reason for 2 is I'm going to show the patient how to put the Facebow on this model, and I'm going to show the parent how to put the Facebow on the second model. I'm then going to get the patient to use the first model and make sure they understand and can do the placing of the Facebow correctly, and the parent meanwhile will do the same on the second model. So what I'm going to show the patient is that there are 2 clips, that the clips can be unclipped here or here, that they point downwards when they're unclipped, that you need to unclip both sides before trying to take the Facebow out, having already removed the neck strap or the head cap or both. Then go to one side only, about where the weld for the clip is situated. Get hold of one side of the inner bow only, like so, and then gently pull the Facebow out on this one side until it pops, like so, and then stop, and then the Facebow go back. And then if you go to the middle, you'll find that the second side will almost just fall out if you're correctly adjusted for it. And then I'm going to show them how to put it in. That's to fit one side in the tube, and then the other side, they're going to have to bring it forward a bit, in a bit, and then back into the tube housing, and then lock one side, and then lock the other side. Make sure they do it properly, and then get them to do it a couple of times. Get the parent, whoever's with the child, to do the same, and then show them how to fit their own Facebow in their mouth, and get them to do it viewing the whole process in a mirror that ideally is static, that is attached to a wall or a fitting, so that it doesn't move, and they can have they can see clearly in the mirror to what they're doing. You will also need to provide your patient, and especially their parents, with a written set of instructions. These instructions are a copy of the ones that I like to use. They are 2-sided. There's page 1 and page 2. And as you can see, they come with photographs and text. And if you would like a copy of these instructions, you're very welcome to use one. And if you contact TOC, they'll be more than happy to provide you with a copy. Okay, I hope that's been helpful.